How can other conditions look like Parkinson's? Imagine trying to solve a puzzle where several pieces look very similar but belong to different pictures. That's often what doctors face when diagnosing Parkinson's disease. Many other health conditions can cause symptoms that seem like Parkinson's, making diagnosis tricky. Parkinsonism is the term used for a group of neurological disorders that cause movement problems similar to Parkinson's disease. These include tremors, stiffness, slow movements, and balance issues. But not all Parkinsonism is caused by Parkinson's disease itself. One major group that can mimic Parkinson's are the atypical Parkinsonian disorders, sometimes called Parkinson's plus syndromes. These are neurodegenerative diseases that share some features with Parkinson's but differ in how they progress and how they respond to treatment. For example, multiple system atrophy can cause rapid worsening, poor response to common medications like levodopa, and symptoms like blood pressure problems and coordination issues. MRI scans often show specific changes in the brain for this condition. Progressive supranuclear palsy is another example. It often causes difficulty with vertical movements, early trouble with balance, and does not respond well to Parkinson's medications. Brain imaging can reveal characteristic signs that help distinguish it. Corticobasal degeneration may cause stiffness in limbs, abnormal muscle tone called dystonia, jerky movements known as myoclonus, and even a feeling that a limb is acting on its own, called alien limb phenomenon. Speech problems are also common. Dementia with Lewy bodies shares some brain pathology with Parkinson's but usually involves early cognitive decline and fluctuating mental status. Patients often do not improve much with Parkinson's medications. Other conditions can look like Parkinson's too. Essential tremor causes shaking that worsens with movement, and like the resting tremor typical of Parkinson's, it usually does not include stiffness or slowness. Vascular Parkinsonism results from small strokes affecting the brain's movement centers, leading to gait difficulties and poor medication response. Normal pressure hydrocephalus is characterized by walking problems, urinary incontinence, and memory issues. Brain scans show enlarged ventricles, and sometimes draining cerebrospinal fluid can improve symptoms. Certain genetic or metabolic disorders, such as Wilson's disease, can also cause Parkinson-like symptoms. Wilson's disease involves copper buildup in the body and can be treated if diagnosed early. Drug-induced Parkinsonism is caused by medications like antipsychotics or anti-nausea drugs. Symptoms often improve after stopping these drugs. Sometimes, psychological factors can produce movement symptoms that look like Parkinson's, known as functional or psychogenic Parkinsonism. These symptoms may be inconsistent or fluctuate, which can help doctors identify them. To tell these conditions apart, doctors relying on a detailed medical history, physical examination, and response to medications. For example, Parkinson's disease usually responds well to levodopa, especially early on. If symptoms do not improve with this medication, it suggests a different condition. Additional tests like brain MRI scans can reveal distinctive patterns or brain changes that help differentiate these disorders. Getting the diagnosis right is crucial because treatment options, prognosis, and management strategies vary widely. While Parkinson's disease is primarily diagnosed based on clinical features, supportive tests and observations help exclude other conditions. Recognizing these differences ensures patients receive the most appropriate care. In summary, many health issues can look like Parkinson's disease because they share core motor symptoms. But by carefully examining symptom patterns, progression, medication responses, and additional signs, healthcare professionals can distinguish between true Parkinson's and its mimics. Always consult a healthcare provider for an accurate diagnosis and personalized advice.